We are Forward Birth Solutions. This name derived from a team of four. We were originally a team of three. Um, my name is Lauren Newman. I am a design and communications manager with PTBI. We have Kendi Mendoza, who is our PTBI fellow and student, Andrea Messias, our developer, and it was really just us three. She added in her wonderful husband, David Rosa, who's also a developer. We're going to start with the problem. So our problem is the Black maternal health crisis. Black women in the United States are 3 to 4 more times likely to die from pregnancy-related causes than white women. And the rate of late maternal deaths among Black women is more than 3 times that of other racial groups. Also, Black moms and families are fearful of hospital settings and providers based on a history of being unheard and unseen, which has led to preventable pregnancy complications and death. I was going to walk you through all of our ideas, but we have 5 minutes, so I'm not going to do that. I'm going to tell you the idea that we ended up going with. We went with the problem statement of under respectful care, and our idea was to develop an app where patients can leave reviews on the provider and the care they received. This info will be sent to the provider, and additional resources will be sent to the patient. So the idea is, imagine an app where you can text a number and leave a review for your provider based on your service and quality of care. Your provider will be notified when you leave a review. Information will be plugged into a form or a spreadsheet. And let's say you send a negative review to your provider, they will get a link to anti-racism training resources that they can utilize for future dealings with their patients. And if the patient leaves a negative review, they will receive a follow-up message with resources on how to proceed. And with that said, we did have some complications earlier with our demo, but I got word from Andrea that they got it working. So Andrea, are you ready to take over?
I'm ready.
Okay, do I need to stop sharing or?
Yeah.
Okay, let me stop sharing.
Okay, so can you see my screen? Yeah.
Yep.
We are gonna demo what we built. We use Twilio, it's called programmable voice recordings, and also DeepGram AI, which is a tool that transcribes and also analyzes the general sentiment of the call. So I'm gonna demo for you.
This call will be recorded and analyzed for settlement.
Unfortunately, my experience was quite disappointing. I have to wait for over an hour. I felt like I was not being heard, and my concerns weren't taken seriously. And I tried to explain my symptoms, but they seemed impatient and dismissive, and I left with more questions than answers. So we should see the sentiment analysis working in a second. Okay, so we got it there. And you can see it's like super negative. It will evaluate from 0 to 1. And this is like beyond 0. So we think that with this tool, there's 2 values on it. That this is data that is very valuable to see, like for demographics, if certain groups are feeling like the services are dissatisfying for them. But also we can do some automation to immediately send a response, an SMS message to the person that left a negative review with resources, and just to help them feel like they are being heard and that they have options. And, just this is something that I think it's just very valuable, even just like words of encouragement and some resources. So yeah, this is just a demo, but I think it can grow into an app where both the providers, managers, and also patients have access to it, and it can become more complex. And that's pretty much it. Thank you.
Thank you, Andrea. Are we at time? I don't have a time check.
Sorry, you still had, I wish there was actually a timer in Zoom, but they don't have one. I'll give y'all 2 minutes to finish up your presentation.
Great. Great. So, I mean, we know who our target audience is. We have our Black mamas, birthing people, birth advocates, providers, and families. This app, um, our ideal client will gain more confidence at doctor's visits, and this app will assist in fighting against the Black maternal health crisis. If we were to market this, of course, social media is a great tool, but ideally, we would love to see this being marketed in clinics and in partnerships with other organizations that are providing resources to Black families. Um, Measuring our success, the community and Black mamas, birthing people, and providers would be aware of the Forward Birth Solutions app. The outcome of this app is reflected in a decrease of the current Black maternal mortality rate, and Black mamas and birthing people feel safe, seen, and heard. I hope I wasn't talking too fast, but thanks for listening. That is Forward Birth Solutions.